there's this concept of deposits when you go to private hospitals. So why do private hospitals request deposits?
Private hospitals require deposits because Nigerian patients run away.
So let me ask you some rapid fire questions.
Ooh.
Just true or false. Number one, are you ready?
Yes, I am.
Private hospitals are making huge profits.
Huge. False.
Why do private hospitals require payment before treatment? Is it greed? Is it survival? Is it policy? Or is it more complicated than it seems? We'll answer that question and many more on today's episode. Welcome to the Care Conversation podcast, a honest space for healthcare conversations that you don't hear often. My name is Dr. Temitope Oyetunji. I'm your host today, and I'm joined by Dr. Omolara Olagunju, a consultant family physician, the medical director of MEF Specialist Hospital in Abuja, and the founder of New Paradigm Health Foundation. Dr. Omolara, thank you so much for joining us today.
Thank you, Dr. Oyetunji. It's all my pleasure being here on the set.
Thank you. All right then, let's get to it. But before we dive into the discussion, we just rounded up our inaugural patient-doctor forum, and we are still trying to unpack all the insights that emanated from that forum. So I want to ask you, you were a panelist at that forum. What stood out the most to you?
Thank you very much for this question. PDF Nigeria was such a successful program, and one thing that stood out for me was the fact that both the patient, the doctor, and the caregiver all want the same thing. It's just that we've all been seeing things from different angles, So it's just a question of everybody understanding the same matter from a different perspective. And that stood out for me.
Oh, fantastic. The theme was humanizing healthcare in Nigeria, empowering patients, caregivers, and providers. As someone who runs a hospital, what does humanizing healthcare mean to you?
So before I stepped into my role of running a hospital, I had been a doctor for over a decade, and I had seen the processes that go on to ensure that patients come into the hospital ill and they go back home healthy, right? And sometimes, because it's something we've done over and over again, one may lose touch with the human part of attending to patients. I remember when I started my training as a family physician. By the way, I'm a family physician. When I started my training as a family physician, one of the things that my trainers hammered into us then was the fact that our patients were not cases. They were human beings. So it's quite easy for a healthcare practitioner to quickly lose touch with that human part of healthcare and just see it as another vocation, another work. However, it's more than that. For a healthcare practitioner, a patient may come in and the case may be 1 out of 100. For that patient, it is 100 over 100.
Yeah.
So that is one thing that is very important when it comes to managing patients.
All right. So one thing that stood out for me from the forum was that the perceptions that patients have about healthcare providers really go a long way in how they approach healthcare. So you are a young female consultant leading a private hospital in the capital city. Can you tell us a little about your journey?
It's quite interesting. I didn't look for that role. I would say the role looked for me because I didn't even plan going in that direction. However, it found me. And what my experience has been in a short form is fantastic.
Wow.
I've enjoyed every step of the way. Has it been challenging? Absolutely. But it's been good. I've learned, I've grown. My eyes have opened to things that I may never have seen if I didn't step into those shoes to run the hospital. So yes, it's been quite interesting, and the fact that this hospital is within the Federal Capital Territory is another challenge on its own, because there are many hospitals and you must survive. You must survive. You must be able to manage all your processes, irrespective of what is going on in your environment, economic wise, and all of that. So it's been a lot.
Okay, so for someone watching this who wants to, go in this path, so what do they need to do to get here? What did you do to get here?
Honestly, it may sound so simple, but what I would say is that everything your hands find to do, do it well. Because if you do it well, unknown to you, you are preparing for the future. So wherever you are at the moment, ensure that every responsibility that has been given to you, carry it out to the best of your ability. You don't really have to fight or force your way into such roles. When you do well, you naturally stand out. And when you stand out, responsibility will find you. As a matter of fact, we have a debt of leadership, good leaders in our environment. So when you stand out in whatever it is that you do, work will find you out.
Yeah, but of course, you went to medical school, you became a doctor,
Oh,
and you
yes.
went through residency
Oh,
too.
yes, of
Okay,
course.
as a family physician.
As a
So you
family
spent, after
physician.
medical school, you still spent 6 years?
Another 6 years
Yes,
plus.
residency, then, okay, so that
Yes.
we know that it's not beans.
Of course, I didn't keep my certificate on the streets.
Okay, all right, that's fine. Okay, so in my book, The Smart Doctor, I touched on a particular aspect of healthcare that we don't usually talk about, especially for female doctors. There's this cultural perception about authority, and many of us have experiences that are different from what our male counterparts have. Now, you are a female in a position of authority. Have you encountered any challenges that has to do with your gender? And how have you been able to navigate that?
Oh, most definitely. Yes, I have. And I have experienced, I'm experiencing, and I may still experience in the days or years to come. Why? Because the medical space is a male-dominated space. However, we have a lot of women who have done excellently well in times past. And so, I mean, there are many examples that have gone ahead. And what has helped me is the fact that, first of all, I understand that leadership is not bullying. And leadership is not trying to make people do things by force. Leadership is influence, primarily. So when I understand that my job is to influence other people, do what they know how to do well, and not necessarily shove ideas down their throat. Oh, what do you think? How can we do this better? Have an open mind. You'll be able to carry everybody along, and eventually the work gets done. So that's one thing that has really helped, and not necessarily thinking that it's a forceful thing and you just have to push people to do things against their will.
Yeah.
No, that's not the way.
So leadership is not bullying.
Leadership
It's
is not
influence.
bullying. Yes.
Yeah, that's what I'm taking from that.
Yes.
That's quite good. Okay, so but as you mentioned before, there have been challenges.
Oh, yes.
Yeah, so what are some of the challenges that you face as someone who runs a private hospital in, somebody said BT era yesterday. You have an idea of what BT
I
era
don't know
is?
what that
Bola
is.
Tinubu era.
Oh, wow. Interesting.
So that's the new name for it, BT era. So for someone who runs a private hospital in this BT era, what are some of the challenges that you face that people may not see from the outside?
There are several of them. But one of these challenges that I would like to talk about was when we had a lot of fluctuations happening to the naira against the dollar. And knowing that in the hospital, up to 80% or more of the resources that we use, either consumables or non-consumables, are imported. And so because of that, we fix our prices based on the current exchange rate. And then all of a sudden, we wake up the next day and the exchange rates have changed, whilst the prices have been fixed. What happens? Who do you go to explain to that prices have been fixed? And so it was a lot challenging trying to get our footing at some point when that was really much of a problem. However, I mean, we've got our fingers burnt at some point, and we've moved on. We learn better. We learn every day, and we've been able to also put mitigating factors or mitigating steps so that we don't run into issues quite often. Doesn't mean that we are totally insulated, but at least not as bad as it was at some point.
Okay.
Yes.
Now that brings to mind something that happened while we were preparing for the forum. Okay, so we were going around for sponsors, looking for sponsors. We actually approached a private hospital in Abuja. And do you know the reason he gave why he was not going to support us with that much? He told us that before, just some few months before that time, the money that they used to spend on diesel was a certain amount. But in the space of a few months, because of the increase in oil prices and all that, the price of diesel skyrocketed, and so did their electricity or diesel bill. And for that reason, he was not going to be able to give us what we wanted. He ended up giving us something, but not what we wanted, just because of that. Do you face that problem as well?
Absolutely. Yes, I do. In fact, diesel prices increased over 100% in the last 6 months. And I cannot go to tell my patients, oh, sorry, you can't have power supply because diesel is now costly. So we have to find a way to include those costs and just level up somehow. So yes, it's quite challenging. And it's not everything that everybody must know. And those are one of the hallmarks of a good leader. You must be able to absorb pressure, absorb a lot of things coming against you, and still come out smiling, everything running well, and still deliver.
Let's get to where we're going.
Okay.
Right. Now, one of the emotionally charged topics is about money and healthcare. So let me ask you this. Why do private hospitals request or require payment before treatment?
Oh, wow. Interesting topic, interesting question. Well, let me back up a bit.
Okay.
Before I came into the private hospital space, I might have been asking this question too, probably from a place of feeling bad or trying to castigate private hospitals. But when I came into the space, I realized a lot of things, and I'll highlight a few of those. Right. Now, a hospital is not a philanthropy organization. I think we need to get to understand that it's not a philanthropy organization. And as a matter of fact, healthcare costs a lot everywhere in the world. This is not just a Nigeria thing. Healthcare is costly, and that is why health insurance is something that is very important, because at the point when healthcare issues crop up, insurance is the best way to mitigate, right? So that's one thing that we must understand. Now, if a hospital is not a philanthropy organization, what that implies is that, first of all, we need money to give services, to provide good, excellent services to our clients and customers and patients, and in return, we must be able to at least recoup the money back. Now, if a hospital stays at the level of, I invest A amount and I get exact A amount back, give that hospital 6 months to 1 year, that hospital will cease to exist. So at every point when the hospital gives a service and someone pays for that, the hospital at least expects a prime back, meaning something should be put on top of that so that this service can run. So because of that, people should always understand that even the power, you go to a hospital, there's power supply, the ACs are working, the toilet is not blocked. The floors are mopped. It smells good. Money goes into those. So it's not free of charge. And even though I'm not of the opinion that private hospitals must be money oriented, however, we need money. We need money to ensure the hospitals run. And don't forget, government is not supporting any private hospital with funds, so you must be able to generate
From
the
that
money.
money, you pay
Yes, you
salaries,
pay
you keep the
salaries.
lights on, keep the
Yes,
place clean.
yes. Buy reagents, buy drugs. You go to the market, you buy a particular medication for a particular amount. You go the very next day, the prices have skyrocketed. So you need one, and all of those are things that you must put into consideration when you fix your prices. So please bear with us.
Okay, we're hearing that. Please, you need to understand these things. That's why we're having this conversation, to bring everything out in the open. It's just a matter of, reasoning about it from the other person's perspective, just like we said when we started. So when patients say hospitals only care about money, how do you respond to that?
Wow. Whenever I hear that, it's something that actually pierces my heart when I hear
Oh,
that.
yeah.
Because we don't care about money. Or let me say, we don't only care about money. We care about money and many other things, right? I had explained earlier why money is very important. However, we care about you. We actually care about you. We want you well. We want you healthy. And when we hear such comments, it just is like it just pierces my heart, because I'm like, oh my God, this person doesn't understand. However, I must tell that there are some bad eggs.
Yeah.
And because of those bad eggs, most private hospitals have been painted black. And everybody just thinks that every private hospital is just out there to milk money out of you, right? But that's not true. You need to come across some good hospitals that actually care about you. Look out for your well-being, your welfare, ensure that you're fine, ask after your family members. And it's not because they want to get your money, they just care about you.
Yeah.
So I think that's it. And I would also like to say that people have to be careful where they go to get healthcare services. You have to be very careful. You have to be discerning, if I may use that word, and ask people,
Yeah.
ask other
Yeah.
people. Don't just fall prey of charlatans who call
Yeah.
themselves doctors or nurses, or run clinics that don't even have the certificate for what they claim to be able to do or have even done. Some carry out procedures that the patient has no business doing, just so that they can get some money from the patient. So yes, those people do exist. However, not everybody is like that.
And
So,
that's one thing we need to understand.
Oh, yes.
And I love what you said about asking questions. So because you saw a sign that this is a hospital does not mean that you can, especially when it's a private hospital, does not mean that you can just go in, do a background check.
Yes.
Right? Ask questions
Yes.
before you trust yourself to
Yes.
people.
Yes.
Right? Okay. So let me ask you this one last question about that. So is there a balance between, we talked about sustainability, making money so that you can survive. Is there a balance between that and compassion?
Yes, there is a balance, even though sometimes it's difficult striking that balance.
Okay.
Very difficult striking the balance. I mean, I've had several experiences whereby a patient comes in, the patient is obviously very ill, and we know what to do, we know
Yeah.
how to help, and what we need to do to help would cost the patient some money. And this patient may not be able to afford, and we can see obviously that this patient does not have the means to get the health service he or she requires. If you want to go all compassionate, you would lose money, because I've got my fingers burnt many times. Patients will promise they will come back, patients wouldn't come back. Some of them would even leave their belongings in the hospital,
As a
like
sign of
as a
proof that
sign
they'll
of
come
proof
back.
they'll come, and they will not come back. I have so many things in the
Wow.
hospital, right? And because of that, We've had to put a lot of structure and policy around it.
Yeah.
And I also think that one major thing that private hospitals can do is better communication. Communicate with your patients. Let them understand from your own point of view. When they understand, it's easier for you to get everybody to be on the same page. You don't lose out, they don't lose out, right? And eventually everybody is smiling. But I must tell, it's not always easy striking that
That
balance.
balance.
If you want to tilt more towards the I want my money before I give the services, patients will suffer. And if you want to tilt to the side of, oh, I care about you, don't worry, you'll be all right, the hospital will suffer.
Yeah.
So it's just being able to strike the balance. Sometimes you may need to write agreements,
Okay.
you may need to involve a third party, you may need to get some form of insurance. Apart from the insurance schemes that we have around, there's some other facilities or organizations that create that platform for patients. There are some banks that do that, whereby they can pay the patient, they can pay the hospital, beg your
Okay.
pardon, and then the patient will find a way to pay them back. So there are many options, but I must, as I said earlier on, it's a very
It's
difficult balance to strike.
I agree with you. And another option usually is if a patient comes in, maybe this happens often where I work, a road traffic accident, they take to the nearest hospital and then we just give first aid, just stop the bleeding or do major
Absolutely.
things. And when you see these people cannot really afford, then we refer
Absolutely.
to government hospitals. And that brings me to the next question, emergency services and private hospitals. Now, not too long ago, there was a story in the media of somebody who had a snake bite and then they went to a private hospital, but unfortunately that private hospital did not have anti-snake venom, and then they had to transport them to a government hospital, and this person eventually died. And people were like, private hospitals should have anti-snake venom. They should be able to do that. So what do you have to say to that? How would you educate the average person watching this who does not know how the layers of healthcare or how they work?
Oh, thank you for this question. It was quite unfortunate that we lost such a person a few months back. However, we all need to understand how the healthcare system works. There are several tiers of healthcare delivery. The first and the most important is actually the primary healthcare service delivery schemes, whereby, or hospitals or centers, whereby these people can attend to about 80% of the issues, health issues that people have. Now, they are called primary. It's just like thinking of primary school. It's basic, not technical. It's not so technical. Of course, when patients come to them, they can attend to that basic issue. And at some point, they are trained to be able to identify that beyond this, I'm not equipped, either human resources or any other form of resource. I'm not equipped to handle this case effectively. At that point, the primary healthcare center is expected to refer to the secondary healthcare center, right? And from secondary also to the tertiary. Now, most private hospitals are set up to be able to handle primary healthcare issues. Primary healthcare issues and some secondary healthcare issues. But a good private hospital is one that knows her limits. So when you know that I can't handle this, I move up. Now, I want to say something about getting the required consumables or medications. A lot of things go underground when you stock up, for example, in a hospital. We have a lot of issues with stocking some medications that for a whole year,
You don't use it.
you don't use it. And eventually this medication gets expired or you just realize that it's not fit for use any longer. You pack it up and throw it away, right? And that is money,
Yeah.
literally carrying money to
Down
throw
the drain.
away. So it's also a balance, right? And it happens everywhere, of course, but there are some medications that are necessary emergency medications like anti-snake venom and all of that. It's important that the private hospitals or private facilities stock it up, but they may also not have it available in the country, right? So that may also be a problem. And they are not financially buoyant enough to probably source for it overseas, because it costs a lot of money to source for these things in large quantities. And when they even source for it in large quantities, how would they use it? How would they use up everything, except they collaborate with other hospitals, and that is dependent on the other hospital if they want or not. So it's there's a lot that go on underneath what we see on the surface, and so it's not as straightforward as we think it is.
Yeah. It's never simple. It's never simple. There are usually layers to the thing.
Several layers.
All right. So there's this concept of deposits when you go to private hospitals. So why do private hospitals request deposits?
Private hospitals require deposits because Nigerian patients run away. You as a healthcare practitioner, because of your level of experience, you already have an idea how much it would cost to put this patient back on his feet. So you tell them, okay, please put a deposit of an amount of money into the hospital account, knowing fully well that you are going to exhaust this money. And if for any reasons these monies are not exhausted, they are usually returned back to the patient. But the reason for the deposit is because of the fact that a lot of people go away without paying. And so most private hospitals run into debt. It happens everywhere, even in public hospitals. But public hospitals are government funded, and they have a lot of shock absorber to cushion the effect of all these kind of things. But for a private hospital, every kobo counts. So most times we ask for deposits so that we can get
like
ourselves
insured.
Policy. Yes.
Okay.
It's a form of insurance policy.
All right. Okay. Fair enough. Fair enough. All right. So let me ask you some rapid fire questions. Just true or false. Number one, are you ready?
Yes, I am.
Private hospitals are making huge profits.
Huge. False.
False. Okay, I know this for a fact, right? Because I did a lot of walking around asking private hospitals for money, and I found out that they are not making a lot. And that was why it was difficult for them to even part ways with the little money we were asking for.
A lot of private hospitals are just trying to keep their head above the water.
Exactly.
Yes.
All right. So doctors in private hospitals intentionally order unnecessary tests.
False. Oh, maybe. So can I say something about that? Yes. Because, I mentioned earlier on that there are many people under this umbrella called private hospitals. So I can only speak for what I'm aware of. So the risk is, or let me say the tendency is there, right, to order for tests that are not necessary. And that's why I'll encourage patients to engage with their doctors.
Exactly.
Please
ask questions.
What tests am I doing? Why am I doing it? How does it relate with the issue I came with, the complaints I came with, so that you are very clear, right? And sometimes the doctor may request for a test that doesn't necessarily align with what you are complaining about, but he is foreseeing a problem.
There's a reason for it.
Yes, and he's trying to mitigate before the problem comes to meet you in the house, right? So please ask questions, engage with your doctor.
And don't jump to conclusions, just like you've said. Ask. There might be a reason for it.
Yes.
But what you are calling unnecessary might actually be necessary.
Very necessary.
You just need to ask the doctor, and then they will explain it to you. All right.
And if actually the test wasn't necessary, then you know where not to go again.
Exactly. So doctors earn most of the money patients pay.
Oh, wow. How I wish.
I didn't know you like money.
How I wish.
Okay.
Most of the monies you pay are used to run the hospital, buy drugs, buy reagents, pay for sanitation, pay for waste disposal, many things.
Okay, so that's a false one there. Okay, so hospitals enjoy keeping patients in admission for longer than necessary.
Maybe it also falls under the earlier category
Yeah.
I mentioned. I for one, I don't do that. In fact, I can't wait.
For you to go.
Yes, so that the bed is available for somebody else who is
Who
more
needs it?
critical, who needs the bed. So no, but it may happen in other places. I can't tell.
Okay, so what's the answer to that one? True or false?
Maybe.
Maybe. Okay. All right. So the last one, private hospitals are richer than government hospitals.
I don't think so either. And it depends on what you mean by richer. Is it financially? It depends. It depends. Government hospitals are government funded. Government is rich, right? And private hospital, for everything they do, they pay. So eventually, by the time you're done paying for everything, you may not have much left. So I don't think so.
Don't think so. All right. All right. I think that's it. That's all the rapid fire questions. So
Okay, survived
let
it.
me, yes, you did. You did. And you did well.
Thank you.
All right. So let's take the last question. We're wrapping up. So if every Nigerian could understand one thing about how private hospitals operate, what would you want them to know?
One thing you must understand about private hospitals, and I'll be saying this coming from judging from where I practice, is the fact that we want you comfortable, we want you healthy. As a matter of fact, we want to make you happy. You know why? When you are happy,
You
you
come
come
back.
So we want to do all that we can to make you happy. However, sometimes while we're at it, we may cross paths with you. We may step on your toes. We may do some things you don't like. But believe me, what we really want is
To make you happy.
Make you happy.
All right, thank you so much. I like that. I like that. So people should understand that. like where I practice, this is something that is drummed into our ears that healthcare is like an hospitality industry and you want to keep your customers happy.
Yes.
Yes. So it depends on how you interact with the system. If you know how to interact with the system, if you know how to ask questions, nobody will be able to order unnecessary tests on you. Nobody will be able to, do what is not right because you are on top of the game. You are asking the right questions.
Yes.
You are engaged in your own healthcare and you're not depending on the system entirely, which is what we advocate
You're a
for.
stakeholder.
Yes, you're a
an active
stakeholder. You're an active stakeholder and you're engaged in your own care, which is what we encourage at PDF Nigeria. Thank you so much,
I also
Dr.
want to
Molara.
add something.
All right.
I always tell my staff that apart from the fact that we are selling healthcare, because that's actually what's it's a marketplace, and we are selling healthcare, we are selling emotions. I keep telling my people, we are selling emotions. So for every client or every patient that walks out of the hospital unsatisfied, you have lost several hundreds. So ensure that on top of the good health, the patient is happy. Yeah, very important.
Thank you so much. That's what we have for you today on this episode. Do well to follow us on our social media platforms and stick around for the next episode. And remember that better conversations leads to better care. See you in the next one.